July the 1st, 2018, and welcome to another edition of Community Issues. I'm your host, Omar Rashida. Join me live right here on Lisa Access Studios. I have a very special guest, Mr. Wes Southall. How
Thank
you
you,
doing,
sir.
man? So you work under the Community Partner Support Program with the Delaware, under the leadership of the Delaware Health and Social Services. Just give a brief overview of what that program is about and what is your environment.
Okay, it's the Community Partner Support Unit, and what it is, it's a unit out there to go out into the community to meet the community where they are. I work under the umbrella of DSS, Division of Social Services, which is under the Department of Health and Social Services. I'm the Chief Administrator for that group, also the Chief Administrator for the Wonder Project in Delaware.
Okay. Now let's talk about your employment program. I mean, it's a fascinating program. I met a couple of your co-workers a couple weeks ago at the community service building, and Duffy Samuels introduced me to them. He said, "Hey man, you got to get these people on your show." So talk about how your employment program works.
Okay, yeah, you met two of our staffers who are extremely enthusiastic and motivated, Tamira Walker and Ajana Wing. They were out there spreading the word about our group. As far as the employment and training piece is that we go out into the community and we partner with different employers in the state of Delaware. Mm-hmm. At this point now, we're currently partnered with just maybe north of 12 actual employers and more contracts going out. Mm-hmm. And we'll talk to the employer and say, hey, listen, we have a litany of folks in the state of Delaware who are eager to work. What kind of jobs do you have? And they tell us what jobs they have. Mm-hmm. What we do, we case manage those clients and we talk to the employers. We also offer the opportunity to subsidize their wages. So if there's an employer out there who says, hey, listen, I'll take a chance on you folks, they go through the same process, they interview them, they determine if it's a good fit. If they hire them, for the first 4 to 6 weeks, up to $13 an hour, we'll subsidize them. So it's a win for the employer, it's a win for the client, and while they're doing that, we'll actually case manage, meaning we have interaction with that client and interaction with the employer to make sure things work out well.
Okay, let's talk about your clientele.
Mm-hmm.
Who is your clientele? Are there people that's being referred to your program, or do you work with other organizations in terms of bringing clientele to your program, and what is the eligibility requirement?
Our clientele can be any Delawarean who's receiving our services under the Division of Social Services. Okay. We determine eligibility for Medicaid, purchase care, which is child care, mm-hmm. Food benefits, general assistance. So we have TANF clients and SNAP clients also. So if any of those folks out there, those are our clients. Those are the folks we interact with.
Okay, a second, let's stay with this for a moment. The employers, the type of jobs that you have. Like I'm walking in, I'm a new client. I want to know what type of employment jobs do you have? Is it blue collar jobs? Is it white collar jobs? And who are some of the, I guess pretty much well established employers that you're currently working with? Okay,
some of the employer names that most folks would be familiar. We have a partnership with the Marriott Hotel. Okay. We work thoroughly with UPS. We have a partnership with Graham Towing. Mm-hmm. We have a partnership with Corporate Interiors. So there's over 12 some odd different employers out there, and the jobs range. We have a partnership with Pedro. Right. So what happens is that some of the employers have different needs, and depending upon what the client wants to do and what they're ready for and job ready for, we try to direct them in that area. And then we continue to support them. Some of the jobs are permanent jobs, but it might be part-time jobs. So we'll support the client through that process and continue to work with them until they can get another job or more jobs.
Right. Okay. Let's take a game with the employment training, the training aspect. Mm-hmm. Some people may lack work experience. And some people, I mean, I've seen in job fairs because I work in the field where people are wearing Timberland boots, jeans, and a T-shirt. So do you guys teach people proper interviewing skills and techniques, how to dress for an interview?
Yeah, there are two vendors who work with the Department of Labor in the state of Delaware. That's Career Team and Business Interface. Right. We also work with Peers Mentoring Inc. and DePaul Industries. Mm-hmm. And they all have their work-ready, job-ready programs where they take clients in, they provide them with the knowledge of what to wear at different job interviews, how to prepare for a job interview ourselves, and they also help with resume writing, and they have coaching moments to make sure that our clients are work-ready when they actually go out there. Right. And then even with peers and some of the other programs, they teach them certain construction skills so they can go to that type of job.
Right. And so in terms of the jobs, you guys actually transport people to and from jobs. So I mean that's something that's brand new because here especially in Delaware, Wilmington, Delaware, Newcastle County, Delaware at least, the bus system doesn't maybe run till like 11 o'clock. Some routes are limited on Saturdays and Sundays. Some don't even run at all. So You know, and that could be a barrier. A lack of transportation could be a barrier for one going to get hired at a job. So talk about your transportation program.
With some, to that point, some employers are good with being subsidized for the first 4 to 6 weeks. Some employers say we don't need that to be subsidized as far as wages. We just need to get clients there. And to your point, what we will do, if there's an employer out there who will hire 5 of our clients and keep at least 5 of our clients on the payroll, we would transport those clients from different locations, Rodney Square, some other places in Wilmington, to wherever that employer is. We will drop them off there at the time they start work, and then we will return when they're finished work and bring them back to those 4 different locations. We have some folks that we're transporting 10, 11 o'clock at night and picking up 2 or 3 in the morning.
Right.
We have some we transfer at 5 in the morning, we're picking up later in the day.
Now, is there a fee for your transportation service?
No, not for, no, there's no fee at all. What we try to do is remove, as you said, some of the barriers. If transportation is a barrier for the employer or our clients, we try to remove that as a barrier.
Another barrier, which is probably one of the main barriers, is criminal background. There are those who unfortunately may have done a mistake in his or her past. When they look at the application and when it says, do you have a criminal history, they're discouraged. They may disregard and continue to apply for the position. So do you work with employers that give people a second chance to have criminal background within the last 5, 10 years? And do you partnership with the pardon program or expungement program that can help people get that off their records?
The short answer is yes.
Okay.
All right.
Okay.
We have a litany of employers who actually will hire folks who've had some mistakes in their past but are ready and willing to make a difference now. We have certain groups who work with them, Peers Mentor in particular, who works with ex-offenders. We also have a relationship with Two Fish, with Keith Smith, who does that also. And then what happens is that if there's an employer out there that says, hey, I'll work with an ex-offender, we have ex-offenders. There's still a program that they go through or training they go to and counseling they go through. And we also case manage them. So as long as our clients, after they stop being, or after they get a job and keep the job, as long as they want to work with us, we'll continue to work with them. And we also communicate to the employer to make sure we maintain that relationship with the client and the employer and make sure it's a win-win on both sides.
And one of the benefits for the client see is, hey man, I'm making that change in my life. I get to provide for my family. I get to provide for myself. I'm being self-sufficient now. It's not like a revolving door when, you know, I get released. I have nowhere to go. I have no job. I have no resources. So I'm gonna go back and commit the same crime and back over again.
Yeah, I think not only does it do that, and it enhances their self-esteem. It gives them an opportunity to be self-sustainable. And look at the other outcome of that is that they become a productive member of society, paying tax, increasing the opportunities for other folks to do these sort of things. Folks make mistakes. We all make mistakes. Folks deserve a second opportunity and sometimes a third opportunity. And there are employers out there who will take that chance and will support and continue to partner with those employers, and we'll continue to support the folks who come out and get into different reentry programs.
One of the things that you mentioned earlier about general assistance, you know, single family making $79 a month, which you can spend that in one day. So with the general assistance program, is the state requiring people who get such benefits to start looking for employment and being involved with your program? Yeah,
there's several of our programs out there, and again, depending on what portion of the media you look at and what you read, folks are not getting rich off this general assistance program. And there's in the state of Delaware, I believe there's a 36-month lifetime of how long you can receive that. So most of our programs, or a lot of our programs, in order to participate, you have to work or go into employment and training. Folks do that. So we try to provide that opportunity for them to come off of general assistance and reduce the amount of benefits that they're receiving if possible, and become self-sustainable.
Your program, we talked about this prior to the program. Some people may not be ready to work right away. They want to do some type of training program, whether it be welding, carpentry, nurse, CNA. So do you partnership with other educational institutes in terms of doing that aspect in terms of training? And then also some people say, hey, I want to go to college. I want to go to Delaware State University. I want to go to Wilmington University. I want to get a degree in this, that, and the other. So do you work with clienteles who just maybe wanted to just go to college as opposed to just working?
I'll answer the first one. We do partner with other organizations or universities or training centers out there who provide that particular skill set so folks can get jobs. We have not yet partnered with folks who say, hey, listen, we're just providing that opportunity. But I think we talked in the back, there's no. So we haven't done that yet, but we're open. If there's an opportunity out there to improve the state of affairs for the folks in Delaware, and it's going to lead to something that will make them self-sustaining and improve their life, we'll be open to it. So to that point, we'll start reaching out by your suggestion to folks out there who provide education or support for education. We do provide tutoring for some of the youth during the summer. We get engaged with folks who provide that tutoring.
Right. All right, live right here, at least that's Channel 28. You're watching Community Issues. We're going to take a short break and we'll return. Welcome back to Community Issues. Once again, I'm your host, Omar Rashid. West Southall is my special guest. One of the extraordinary things that I really love about your organization is that you knock on doors in the community. So talk about that.
Yeah, well, our group goes out, and again, I think I mentioned before, maybe 18, 19 months ago, we're maybe a group, a team of 4. There's more than 30 of us out there now, statewide. And our group will go out there and let folks in the community know what's going on with DHSS or DSS proper and what opportunities are out there. We'll knock on doors, we'll hand out flyers, we'll walk with, I said, Lieutenant Dan Police in the city of Wilmington. We go to different events. We're at Hicks Anderson. There's a social worker at, or staff person at Hicks Anderson during the course of the week. We're at the Department of Probation. There's a person from our group sitting there to meet folks when they go through there to let them know what opportunities are out there.
Right.
We're at LACC in the community twice a week, 4 times a week, I'm sorry, doing that. So where you go, and I mentioned we're at 14 different libraries, where you go in the community, you'll see one of our folks.
Right.
We'll volunteer, we'll show up, we'll be the aid, service, and help folks out there.
So you're very, very visible.
Yeah, we're extremely conspicuous.
So let me ask you, when you're knocking on doors, when you're talking to people at the libraries, when you're talking to people at William Hicks Anderson Community Center, Latin American Community Center, what are some of the concerns that they express?
Okay, some of the folks we bump into, they want to know about some of the things that we offer, Medicaid, purchase of care, food benefits. We'll talk about that. Some folks want to know about what opportunities are out there for jobs. We'll tell them what employers we're matched up with. Some folks might ask, are there training programs out there? And we'll put them in touch with some of the training programs that are out there. Some folks might have issues with homelessness, which is big in Delaware.
Yeah,
we'll put them in touch with the right agencies there, as we're partners with every state agency here in the state of Delaware. So state services, visually impaired, public health, those are our partners also, internal partners, so we can put them in touch with the right folks there and be their advocate and help them along.
You work with so many different partners. How did you go about developing relationships with other agencies? I mean, do you call them or do they call you? Let's say, for example, agencies watching right now and they want a partnership with your program. How do you go about connecting that relationship?
First off, the internal agencies, which are under the umbrella DHSS, that was easy. All the directors, and again, I work for Director Raymond Fitzgerald, all the directors buy into that. They just want to make an impact in the community, and Secretary Walker and the governor support that. As far as external agencies, those actually in the community, when we're literally out there in the streets of the community, folks are talking to us and saying, hey, do you know this place is here? So it might be any organization out there. And we'll go knock on the door and ask them what they do. and really listen to find out what they do, then find out how can we help, how can we be of any service. And it might not be right then and there, but they'll think about, say, hey, do you do this? And if we don't, we'll say, not yet.
Okay.
And we'll try to work on that.
Right, right. And I think that that's so crucial, because in the social service arena, you may have agencies competing with one another in terms of getting grants and in terms of getting clientele. But with you bring about a whole unity thing where, it's not us against them, but you want to work together with them.
One of the great things about what we're doing in community partner support and DSSS is that when we go out in the community, we're not asking for money. We're not saying, hey, can you do this for us? What we're saying is that, how can we help you? And with all sincerity and being extremely earnest, we want to know how we fit in. We want to meet our clients, Delawareans, where they are. We want to remove all obstacles, all barriers, and create opportunities.
Right. So with the organizations that you're partnering with, are they nonprofit, in-profit, or are they just nonprofit?
The community-based organizations, some are nonprofit, some are, as we said, some of the employers are for-profit.
Okay.
So it runs the gamut.
Okay, so there's no way, if you're not a nonprofit, we're not going to work with you. That's great. No, so what's once you place your clientele on a job and you're talking with the employers, what type of feedback do you get from the employers with your program?
Well, when we're talking to employers, we want to find out what we need to do to help our client maintain employment and potentially grow. Right. So we'll get formative feedback from that employer saying, hey, and for instance, let's say West Southall's here. Wes is doing good here, he might need help here, or let's say he has issues with this, then we go back and talk to Wes and say, hey, Wes, how do you feel? And more times than not, the client's going to say, well, I'm doing okay. And then with the feedback from the employer and working with the client, there's other resources out there to strengthen that or to enhance that client's opportunity to succeed and potentially help them grow and get even a better job. The goal is to help all of us, all our clients become self-sufficient.
Right. Now, do you ever act as a mediator when an issue between a client and employer? Do you guys come and step in to possibly help save the job or help the client not quit?
We have not had to come in and mediate because when I say we case manage, we're talking to them pretty regularly.
Okay.
So we try to get there before they get to that point
right.
where it's at a point where we have to say, oh my God, you have to make a decision.
Right.
We're trying to be there with the client every step of the way. We'll interact with the client as long as he or she wants us to. Okay. We'll continue that relationship. We maintain the relationship with the employer because we want to continue to provide them with clients and they can be successful. Definitely. And as I said, depending upon the employer, we either provide transportation or we'll subsidize the wages in some cases. Right. And for the client, it's a win. For the employer, it's a win. They go through their normal process again, interviewing the client. We don't force folks on them. They make a decision. And the caveat there is that we're saying if you hire 10 of our clients or whatever number of our clients, 1 year from now, our expectation, at least 50% of those clients are still there. If that's the case, we'll continue to work with you.
Right. In addition to working with organizations and agencies, you also work with particular individuals who have their own particular program. You want to mention some of the local individuals that people pretty much know in the community?
Well, in the community, I think most folks are familiar with Darrell Chambers from the University of Delaware. I think you folks call him Wolfie. We interact with Cy Solomon. We interact with some Corey Priest, Coley Harris out of Ashes. Lieutenant Dan, you folks see him walking the streets of Wilmington. We interact with folks who are very conspicuous and doing great things in the community. And there's some folks out there I haven't mentioned, they're doing great things also that we interact with.
Earlier in the program, you mentioned, you made mention of, walking the streets with police officers. So one of the thought process that came to me is, the police officer, did they have like a sigh of relief, saying, hey, we got these agencies that could help keep these brothers off the streets, that they're finding jobs for them. It's not like we keep going in, arresting them, but we have somebody who can actually help these individuals.
I think some of the folks in Delaware are aware that the mayor, as well as the chief, has a 4-person unit headed up by Lieutenant Dan that actually goes out in the community. And instead of going through the community with the windows rolled up and no one being able to talk, these folks are literally out there in the community, interacting with the community, talking to folks in the community. And they know on a grassroots level, on the ground level, what some of the needs are. So when they see folks in and day out, they're able to go to them and talk to them and say, what are your real issues? And they say, here's what I have going on. And because they're located right around our Porter facility, more times than not, they'll bring them right to the Porter facility and say, hey, we have this client and here are their issues. And that client really wants to change his or her life. And you have state services there, and you have a great gentleman there, John Cook from state services, doing everything he can there. You have DSS there, you have other agencies there, and the CPSU, they're right in that building.
Right. So just to clarify, your target population in terms of clientele, is it basically 19801, 802, 805 zip codes?
We have a tremendous concentration in 19801, 19802, 19805 because of some of the opportunities where some folks view as issues there to help strengthen that community, support that community. But the CPSU, we're statewide.
Okay.
So some of my folks have offices in the Claymont Center, the Porter Center, Ashley Mansion, Williams, Milford. We're statewide.
Now, in terms of seniors, because there are seniors who like to work. Do your program work with seniors as well, or is it all ages?
We have folks, and again, we're doing things with the youth also. We have folks that we were able to provide or help them find jobs as young as 15.
Wow, okay,
and there's no age limit on how old the folks are. We're helping to find jobs. There's opportunity in the state of Delaware almost for anyone who is willing to work, and there are employers out there embracing this.
Right. I've been interviewing you now for about 20 minutes, and people are wondering who's this gentleman here. So you want to give a brief background of who you are in terms of your background and how you got about getting a state job. And I know you may have mentioned it before, but if you want to reiterate for those who may just be turning in.
Sure. My story is very simple. I'm a native Philadelphia. I'm from the inner city Philadelphia. For those from Philadelphia, it will be north. But if you live there, it's North NORF, Philadelphia.
Okay.
I was raised by a great mom. I had tremendous mentors in my life. I had the opportunity to go to college and get a job at UPS and do reasonably well at UPS. And by that experience, get out in different places. I relocated 6-7 times to UPS all around the country, working in different communities in my capacity as an operation manager, division manager, what have you. Upon retiring at UPS after 38 years, I wanted to do something in the community. My wife and I we came back to the East Coast. We were living in Chicago at the time. And Director Raymond Fitzgerald got me on social media because we've been friends. He's director of DSS, and asked would I like to come and work with DSS. And it was a great idea to come here and interact in social services. As I indicated earlier, about 18, 19 months ago, the Community Partner Support Group was out there doing things in the community. And originally, we would go out in the community and tell organizations that we had this assist portal, and folks don't have to come to all the offices to apply for food benefits, purchase care, and Medicaid. That morphed as we were going out talking to different partners into they had other needs. And we just started to transition and grow and adapt and try to help out with some of the other needs.
Now, your story is extraordinary because you come from working with the UPS and you're going to a field, social service field, which is two totally opposite type of field. So how was the transition? I mean, what was your mindset once you left this to come here?
Well, I think coming out of corporate America at UPS and coming to the social services, I was very fortunate to get the opportunities in life that I had.
Okay.
And the thought process for me in particular is that to help folks have those same opportunity and increase their resources to do that. It's not that far removed, and I think I mentioned offhand that UPS is very conspicuous in the community. They have an urban internship for their upper level management folks to go in the community, and they're very engaged with different activities in the community. You might not see them on the front page, but they're there.
Right there. All right. We have 2 minutes remaining. You have any closing comments? You want to leave a website number, a phone number for those who are watching right now and want to be involved in your program?
I would ask all folks to go to the Community Partner Support Unit website, which is, you can go on DHSS website in particular and hit the links and get there. Or you can email us at community, and it's _partnership_support_unit @state.de.us, or call us at 302-792-0900. Again, 302-792-0900.
Okay, you have any upcoming programs, enrollment programs, job fairs, anything?
Well, there are job fairs all over the state of Delaware. There are different scholarship programs for some folks that there's some openings during the course of the summer that folks haven't taken advantage of. As I told you before, I'll start funneling as much information to you as I can. But if you go to the DHSS website and you see all the things that are being offered, there are tremendous opportunities for the state of Delaware. And we're looking as the governor, Secretary Walker, Director Raymond Fitzgerald, we're looking to make an impact in the state of Delaware and help Delawareans where they want it.
All right, on that note, Mr. Paul Westfall, thank you for being a guest.
Thank you for having me.
Thank you for tuning in to another edition of Community Issues. I'll see you back in 2 weeks. God bless and have a safe week.